Hello everyone, welcome back to our channel. Is fatty liver a silent threat you should be concerned about? What does it feel like when you have fatty liver, and what are the 17 warning signs that indicate the fat buildup in your liver has become problematic? More importantly, what steps can you take to eliminate this fat before it's too late? Today, we'll dive into the growing issue of fatty liver, a disease that has rapidly increased in prevalence across the globe. Back in the 1990s, hepatic steatosis was considered rare, but now it's much more widespread, even affecting children. In the United States alone, over 30% of adults over the age of 35 have fatty liver, and it's far from a harmless condition. If left untreated, it can lead to liver scarring, cirrhosis, and even cancer. To put things into perspective, fatty liver is now one of the leading causes of liver transplants worldwide. You definitely don't want to ignore it. Catching this condition early is crucial because the liver has an incredible ability to regenerate, but only up to a certain point. Recognizing the signs and symptoms early on can prevent the disease from worsening, and with proper intervention, you can even reverse the damage, allowing your liver to heal itself. In this video, I'll break down the signs and symptoms you need to watch out for, and I'll show you how some simple lifestyle changes can help you naturally combat fatty liver. With the right approach, you can take control of your liver health and avoid the serious consequences that come with ignoring this issue. Let's get started. We will discuss 6 initial symptoms and 11 more serious complications that indicate liver problems, emphasizing the urgent need for proper care. Let's explore the symptoms together. 1. Nausea. Nausea is one of the initial symptoms of fatty liver or hepatic steatosis. It occurs due to several factors related to impaired liver function. When the liver's ability to filter toxins is compromised, harmful substances accumulate in the blood, leading to nausea. Additionally, liver inflammation caused by fat accumulation can bring abdominal discomfort or pain, often accompanied by nausea. Impaired digestion, particularly a reduced ability to produce bile, which is essential for fat digestion, also contributes to this symptom. Furthermore, an enlarged liver may press on the stomach and other organs, creating a sensation of fullness and nausea. 2. Fatigue. Fatigue is another common early sign of fatty liver disease. The liver plays a vital role in metabolizing nutrients and generating energy. When fat accumulates in the liver, it can seriously disrupt these functions. In more advanced cases, steatohepatitis, which involves inflammation of the liver alongside fat accumulation, can further intensify feelings of tiredness. The liver's dysfunction may also affect hormone production, impacting mood, sleep quality, and overall energy levels, leaving individuals in a persistent state of fatigue. 3. Right-sided abdominal pain. Discomfort in the upper right side of the abdomen, near the ribs, is another symptom of fatty liver. This sensation can feel like a dull ache or a nagging pain in the upper right quadrant, where the liver is located. The pain is likely due to the enlargement of the liver, which may also press on the phrenic nerve, causing pain around the right shoulder. This symptom is an important indicator of the liver being affected by excess fat. 4. Excess gas. Excess gas is another initial symptom often experienced by individuals with fatty liver disease. Radiologists have observed that the presence of fat in the liver can lead to excessive gas accumulation, which sometimes interferes with the visibility of other organs, like the pancreas, during medical exams. This increase in gas production is likely caused by changes in the gut flora, which directly affect liver function. 5. Loss of appetite. Loss of appetite is a symptom frequently reported by people with fatty liver disease. This can occur due to metabolic changes, inflammation in the liver, hormonal imbalances, nausea, and abdominal discomfort. Psychological factors may also contribute to reduced hunger. These factors, resulting from the liver's impaired function, disrupt the regulation of appetite and overall feelings of well-being, highlighting the importance of medical consultation for proper treatment. 6. Stomach pain and heartburn. Stomach pain and heartburn are common digestive symptoms associated with fatty liver. A study conducted by UFMG found that individuals with hepatic steatosis experienced dyspeptic symptoms like heartburn, a burning sensation from the chest to the throat, belching, and a feeling of fullness more frequently than those without the condition. In fact, these symptoms are 25% more prevalent in individuals with fatty liver compared to only 12.4% in those without it. After discussing the 6 initial symptoms of fatty liver, it's crucial to understand that as the condition progresses, the signs become more severe and indicative of advanced liver damage. Now, let's explore the 11 late symptoms of fatty liver that signal the need for immediate medical attention. Recognizing these advanced signs can help prevent further complications and serious health risks. 1. Swelling in the legs and ankles. Swelling in the legs and ankles, known as edema, is a common sign of liver disease such as cirrhosis. This occurs due to an imbalance in the production and release of proteins by the liver, particularly albumin, a protein that helps keep fluid inside the blood vessels. When the liver is damaged and unable to produce enough albumin, fluids leak out of the blood vessels and accumulate in the surrounding tissues, causing swelling in the legs and ankles. Additionally, liver diseases can cause portal hypertension, an increase in pressure within the portal vein, which can further contribute to fluid accumulation in the lower tissues. Edema can also occur alongside ascites, fluid accumulation in the abdomen, making it harder to manage and more uncomfortable for patients. 2. White nails, leukonychia. White nails, also called leukonychia, can indicate liver problems such as cirrhosis or hepatitis. This change in nail color occurs due to alterations in blood composition and circulation, often associated with liver disease. The sick liver may struggle to process and eliminate toxins, leading to their buildup, which can affect various systems, including blood circulation under the nails. This results in pale, dull nails, where most of the nail appears white except for a thin brown or pink band near the tip. In severe cases, leukonychia may also be accompanied by other nail changes like clubbing, indicating a more advanced stage of liver disease or heart-related issues. 3. Night blindness, nyctalopia. Night blindness, or nyctalopia, arises from the liver's inability to store and metabolize vitamin A, essential for maintaining good vision. The liver plays a key role in storing and releasing vitamin A, which is necessary for the production of pigments in the retina that allow vision in low-light conditions. When liver function is compromised by conditions such as cirrhosis or hepatic steatosis, the ability to store vitamin A decreases, resulting in difficulty seeing in the dark. Chronic vitamin A deficiency can also lead to further eye issues such as dryness, corneal ulcers, or even complete vision loss if left untreated. 4. Palmar erythema, red palms. Palmar erythema, characterized by redness of the palms, occurs due to the dilation of blood vessels, often caused by liver dysfunction. This redness can reflect hormonal imbalances or underlying liver issues such as hepatic steatosis. When the liver is unable to metabolize hormones effectively, it can result in dilation of the blood vessels in the palms, causing a distinct reddish appearance. This condition is commonly seen in patients with cirrhosis or other chronic liver diseases, and may also be associated with autoimmune conditions or rheumatoid arthritis, signaling broader health concerns. 5. Gynecomastia. Gynecomastia, the enlargement of breast tissue in men, is another late symptom of liver dysfunction caused by hormonal imbalances. Excess fat in the liver disrupts the balance of estrogen and testosterone, leading to an increase in estrogen levels. This imbalance can result in the development of feminine characteristics such as gynecomastia. This symptom is often linked to other conditions such as obesity, alcohol abuse, and diabetes, further highlighting the liver's role in hormone regulation. In advanced cases, gynecomastia can cause tenderness or pain in the breast tissue, requiring medical evaluation to determine the underlying cause. 6. Spider veins. Spider veins are small, web-like veins that appear near the surface of the skin, commonly found on the face, neck, and upper torso. These veins occur due to hormonal imbalances caused by liver disease, particularly an excess of estrogen that the liver is unable to process effectively. The increased estrogen levels lead to the dilation of small blood vessels, causing spider veins, which are a visible sign of liver dysfunction. Spider angiomas are typically seen in people with cirrhosis and other advanced liver diseases, and they may become more prominent with time if liver function continues to decline. 7. Red spots on the skin. Small red spots, known as petechiae, may appear on the skin when liver function is compromised. This is due to the liver's inability to produce sufficient proteins necessary for blood clotting, leading to a decrease in platelets, thrombocytopenia. Additionally, liver dysfunction may interfere with the absorption of fat-soluble vitamins like vitamin K, which is crucial for clotting, causing these red spots to form as a sign of impaired blood clotting and liver function. Petechiae are commonly associated with other signs of bleeding such as nosebleeds, gum bleeding, or bruising, indicating a more severe clotting issue that needs medical attention. 8. Dark urine. Dark urine is often an indicator of hepatic steatosis, as the liver's impaired function causes an excess release of bilirubin into the bloodstream. The kidneys filter this bilirubin and excrete it in the urine, giving it a darker color, often resembling cola. Dark urine signals significant liver dysfunction, indicating that the liver is struggling to filter and eliminate waste products effectively. Dehydration and the use of certain medications can also contribute to darkened urine, but when combined with other liver symptoms, it's a red flag that should be investigated promptly. 9. Pale stools. Pale or clay-colored stools are a sign that the liver is not processing bile salts properly, which are responsible for giving stools their normal brown color. In cases of hepatic steatosis, this failure results in stools that appear much lighter in color, often gray or chalky. This is a reflection of the liver's inability to perform its normal digestive functions, particularly in processing fats and excreting waste, and is a sign of worsening liver health. Prolonged periods of pale stools can indicate a blockage in the bile ducts, cholestasis, requiring further investigation to prevent further complications. 10. Jaundice, yellowing of the skin and eyes. Jaundice, characterized by yellowing of the skin and the whites of the eyes, occurs due to the buildup of bilirubin in the blood. Normally, the liver processes bilirubin and helps eliminate it from the body. However, when the liver is not functioning properly, bilirubin accumulates, leading to jaundice. This condition is a critical warning sign of severe liver impairment and requires immediate medical attention. Along with jaundice, other symptoms such as fatigue, dark urine, and pale stools often appear, making it a key indicator of advanced liver disease. 11. Itching. Intense itching, especially in the later stages of liver disease, is caused by the accumulation of bile salts in the blood. These bile salts can deposit on the skin, leading to persistent itching, which is often most noticeable on the palms of the hands but can spread across the entire body. This discomfort is a direct result of the liver's inability to filter and excrete waste properly, reflecting advanced liver dysfunction. The itching often worsens at night and can become so severe that it interferes with sleep, significantly impacting quality of life for patients with liver disease. If you don't have symptoms but have risk factors for hepatic steatosis, it is still important to take steps for early detection. Fatty liver, or hepatic steatosis, can often be diagnosed before symptoms arise, especially if you have any underlying conditions that increase the risk. One of the primary methods for detecting fatty liver is through imaging tests like ultrasounds, CT scans, or MRIs, which can help to visualize fat accumulation in the liver. Additionally, blood tests can reveal elevated liver enzyme levels, which often indicate liver dysfunction. Fatty liver disease is generally categorized into 3 stages: Grade 1, mild, Grade 2, moderate, and Grade 3, severe. Early detection is key because, in its initial stages, hepatic steatosis can be completely reversed through lifestyle changes, protecting the liver from further damage and preventing progression to more severe conditions like cirrhosis or liver failure. If you are at risk, regular screening and medical follow-up are essential for monitoring liver health. Several risk factors increase the likelihood of developing fatty liver. The first risk factor is obesity. Being overweight significantly raises the risk of hepatic steatosis because excess body fat often leads to fat accumulation in the liver, causing inflammation and scarring that can progress to cirrhosis if left untreated. The second risk factor is type 2 diabetes. Insulin resistance, which is the hallmark of type 2 diabetes, causes abnormal fat storage in the liver, leading to fatty liver disease. The third risk factor is high blood pressure, as hypertension often coexists with obesity and insulin resistance, which compounds the likelihood of liver damage. The fourth risk factor is excessive alcohol consumption, which severely damages liver cells, promoting fat buildup and increasing the risk of cirrhosis and liver failure. Lastly, the fifth risk factor is sedentary lifestyle. Lack of physical activity contributes to fat accumulation in the liver, making it a significant risk factor for developing fatty liver disease. Addressing these risk factors through lifestyle changes, such as improved diet and increased physical activity, is critical in managing and preventing fatty liver. Reversing fatty liver involves 4 critical steps. The first step is to avoid alcohol entirely. Alcohol is highly toxic to liver cells, and even moderate consumption can exacerbate fat accumulation in the liver, making it vital to eliminate alcohol from your diet to protect and restore liver function. The second step is to exercise regularly. Physical activity plays a crucial role in burning fat and improving liver function. The goal should be at least 150 minutes of moderate exercise per week, which can include activities like walking, cycling, or swimming. The third step is to lose weight, as even a modest reduction of 5% of your total body weight can result in significant improvements in liver health. Losing weight reduces liver inflammation, decreases fat accumulation, and enhances liver function, all of which contribute to better overall health. The fourth step is to follow a healthy diet. A balanced diet rich in anti-inflammatory and nutrient-dense foods is essential in reversing fatty liver. Cutting down on sugars, refined carbs, and unhealthy fats while increasing the intake of whole grains, lean proteins, and vegetables can help restore liver health. Thank you for watching and taking the time to learn about the warning signs of fatty liver. Understanding these early and advanced symptoms is crucial in preventing more serious liver conditions, like cirrhosis and liver failure. The liver is such a vital organ, and with the right lifestyle changes, many of these problems can be reversed or controlled before they become severe. Remember, the power to improve your health is in your hands, and taking action now can save you from more serious complications down the road. If this video has been helpful, please don't forget to give it a thumbs up and share it with anyone you think could benefit from this information. Also, I invite you to subscribe to the channel so you won't miss out on more health tips and advice like this one. Your support helps us continue to create valuable content that empowers people to make informed decisions about their health. And this is just the beginning. In our next video, we'll explore another critical topic, the harmful foods that can quietly damage your liver. You'll learn which foods to avoid, how they impact your liver, and why making the right dietary choices is essential for maintaining a healthy, functioning liver. It's all about giving you the tools you need to live a healthier, longer life. So be sure to hit the notification bell so you don't miss that video. Stay informed, stay healthy, and I look forward to seeing you again in the next one.